everybody. I'm Wes Warren. I'm here with Greg Stanley, and today we're going to talk about sedation. And we kind of broke it down, or Greg, you broke it down into 6 stages of sedation. First of all, why break it down? How do you see it as 6 different versions of sedation?
That's a good question. First of all, certain markets today are saturated, oversaturated, meaning there's enough dentists that it has a tendency to drive the prices down. For example, a normal ratio is 1 doctor per 1,200 prospective patients. When it gets below that, you start to feel pressure, number one, to either lower your prices on things you do commonly, or probably more important, to get patients. You find yourself either joining every insurance plan imaginable, which is a nightmare, or deeply discounting your introductory offers, which brings patients that are a lot of times less than ideal. So one way to be competitive is to keep fighting for the same market share, bread and butter dentistry, crown and bridge dentistry. The other is to tap into that 50% of the dental market that actually isn't the dental market, meaning they don't come in unless they absolutely have to. A husband or wife drags the other in, kicking and screaming, and ties them to the dental chair because they're so terrified. And, I kind of understand this. I have relatives that have incredible phobia. So they really aren't in the dental market. And so doctors, a lot of people that are in heavily competitive areas, they reach out to new levels of sedation instead of new levels of discount. We know that discount is costly. It can bring you kind of weird patients. It can bring you just not the people you're looking for.
Well, and the discount up front. I mean,
and then the
you're marking out.
Share,
right.
You're competing. You get these people that call you and ask how much something is, and you shoot back trying to catch them off guard with, well, what kind of crown do you want? And they say, I want a zirconia crown with a buildup. That's how you know this area is heavily sought after. So instead, we come up with a way to reach out to people that have stayed away from the dentist because of phobia, maybe a bad experience. But the longer they're away, we used to say that for every year a person was away from the dentist, it was $1,000 to come back. And so a lot of people, it was $10,000 to $20,000 just for general dentistry to get caught up. And they're pretty good about saying yes to that if you can get them in the chair. They say yes to it if you can get it all done at once, or if I can be completely out, et cetera, et cetera. So I want you to think in terms of, like Wes talked about, the stages of sedation. Each of them represent a market. For example, the blue gel market. These are people that probably need almost nothing. You paint a little blue gel on the gums or on the palate or whatever.
Yank the tooth out.
Yeah, I don't know what you do, but the blue gel was a big addition to this offering. And then, of course, the local shot of Novocaine, Citanest, whatever. That gets most people. That's where a big part of the market.
That's where most dentists stop. Let's face it. That's what everybody's doing. That's the basic. And every dentist we work with usually pushes back at anything above that because it's a hassle for them.
Yeah, and they can kind of keep the chair full. Most of them don't have any problem with it until competition moves in on both sides, or until they have associates to feed. And then they start thinking, my goodness, where do I go from here? And so to go farther, the nitrous oxide market, they don't know they're nitrous patients, but they are. When they come in and they're scared and you get them to try nitrous and it's such a good thing, they go out and become this incredible referral source. They come in and get more of the needed dentistry done. It's kind of a hidden market. And, like you said, Wes, doctors are hesitant, staff.
And team members. Yeah, right.
Because well, I'd have to put a cannula on their nose and work around it, or I'd have to keep filling this bottle up every month or whatever.
Yeah, my
I
goodness.
get it,
Yeah.
but let's face it, certain markets have certain requirements. The nitrous one would probably take most doctors up 2 notches as far as their appeal. And it happens with your own patients. You don't have to go out and advertise it. There's no marketing cost. You tell people to try it. You say, if I were you, I'd do, if I was getting this done, I would do nitrous, and they try it and they love it, and they bring their family and friends.
Well, let's talk about cost. So a lot of people, I mean, we always recommend just charging, covering your cost. Some people will do it for free. Some people have just a basic setup. But then there's people that try to make money at it, and that's not what we're trying to advocate here.
Yeah, I had a doctor charge me $350 for nitrous, and there was nothing in the bottle. I was able to tell that for myself, but I didn't care, you know. Yeah, there's a cost. The cannula is $7, whatever's in the bottle, if anything. So usually $20 covers things, but if you got to go to 30, or if you're plumbing your whole office, good. But I would just want to comment, for the most part, most of you are already licensed to deliver at this level.
Right.
It's just what you see as an inconvenience to move forward. But let me ask you this. Have you said to patients, now we have nitrous if you need it? Well, how do they know if they need it? You have to sell them on it, you know, staff have to sell them on it. And I have doctors actually have told me with a straight face, well, it's sitting over in the corner. They know I have it, you know. Well, I guess, but let's face it, it's not getting the job done. In a lot of offices, we've had to actually add a bonus to staff to get people to try nitrous. Now, if somebody comes in and says, I've tried nitrous and it made me sick, well, fine. Either go on to the next level or do whatever they want.
It can happen.
But these are new market shares. The nitrous one gives you access to patients through referrals that you love, without really spending more on marketing. It's not uncommon for you. I hear you, Wes, telling people you got to be ready to spend $4,000 to $7,000 to get into the sedation market or whatever in advertising per month.
Right.
Well, nitrous might cost you what, $500, and all of a sudden you got a whole bunch of new referrals and a bunch of people buying dentistry. So if you want to talk dollars to dollars, it's a pretty good deal. Now, we mentioned other things, oral sedation, which invites snickers from doctors who do IV sedation.
Yeah.
Oh, you're not getting it, man. With IV, you just turn them on and off like a light switch. I get that. But I have doctors that have gone to oral sedation, and they're getting this effect I'm talking about, where they have a whole bunch more people accepting bigger treatment plans, dragging in their friends. They're phobic, but not hyperphobic. And those make a really nice patient. They make a nice practice. But like I said, a real hyperphobic, they don't like to bring in other people because they don't even like to talk about what goes on in the dental office. The oral sedation is kind of the highest level of phobic that I think of as being productive, where they're going to bring you people. Now, IV sedation, that is for the extreme cases. They've been out of dentistry for 15 years. They got a big case. They're ready to say yes. And you have a staff person who's so incredible on the phone that she can talk their great aunt into paying for everything, and that's all good. All of a sudden, you're dragging in $15,000, $20,000 case after case. We've seen doctors make an entire market out of the homeless doing this. A lot of them have dentistry not done for 20 years, and they overhear on a radio somehow and a twilight sedation advertisement. What you have to be good with is leaning in to the offer of sedation, because especially a lot of men will try to pretend like they're not as afraid as they are. And you have to let them know, I mean, I wouldn't do this without it. And that's when a doctor says that, or a hygienist or a staff person, that's when people are really listening. And so they try oral sedation or nitrous, and you're off to the races.
Can I make a comment there,
Yeah,
Greg? It's, we work with a lot of offices that a lot of our doctors are IB certified. Certainly people listening to this are listening because they are certified. And what we've found here is it can be very tricky to get the marketing to work, as anybody listening knows. You get the radio, you get the TV ads working and drive a lot of leads to an office. That can be very difficult, very hard to do. You spend a lot of money. We do see people with pay-per-click doing mediocre, not great, but mediocre. But what we do see is just like you're talking about, where you tell patients, if they've got more than one tooth that needs to be prepped, that you tell them literally, hey, if it were me, I wouldn't do this without sedation.
you
I
probably
would,
wouldn't
I
be.
would be sedated for this. Where you, the doctor, and team members are all in agreement that when we start talking quadrant dentistry, we're going to start selling the patient on sedation dentistry. This is the magic. And people go, okay, why is that magic? Because when people finally decide that they're going to get sedation, they change in their mind how much dentistry they're going to do. They go from, instead of thinking about how little they're going to do, to how much can I do and get it all done while I'm sedated. And you'll start to see bigger cases just develop out of your regular practice right now, but you have to sell them. You have to talk to the patient and in a way that says, hey, I wouldn't do this without sedation. I'm going to put it on the treatment plan. I'm going to recommend that you do this under sedation. Now, you don't want sedation to be a money maker in terms of the dollar amounts. Sure, charge for it, but don't charge an obscene amount to where patients go, oh, $1,000, for $3,000 worth of dentistry. No, I'll tough it out. You want it to be priced at a point where it's $300 an hour after the first 2 hours, to where it's not that much money. And once people decide, yes, I'm going to do it under sedation, they change how they buy. And that's the trick, and that's the magic in it. And that's what if you want to get more sedation out of your practice, that's what you've got to do.
One way to kind of put your toe in the water is get a nurse anesthetist or whatever your state requires and set it up, probably for your day off, Friday, and get an assistant and get it started.
Right.
One doctor, well, I'll tell you, it's Dr. Roy Smith, told me he was so impressed with the gratitude of patients that got sedation dentistry. It just kind of brought him back into dentistry for a number of years. He had just about checked out, kind of had his money put aside, had his life together, time to check out. Well, he really loved treating sedation people. He'd bring them in on a day they were closed because they had all the time in the world, and just take their time and make it a great experience for people. It changed his life, not just the patient, it changed his life.
Yeah, there's no better patient than the one that's asleep.
Yeah, let's talk about that too. IV is going to require a few staff in the office to get special clinical training.
Yeah, for sure.
To make this a safe environment. And by the way, I know some of you have already had a close call. Even with an injection, you had a close call, and it leaves you almost afraid to do anything. Well, you need to relook at that, because if you're going to stay in dentistry, eventually the sedation market is where we're going to go. I mean, because the regular market gets a pile-on effect. People flood into your area, they come out of school, they come from overseas, and they all land next door. So to expand that market, number 5, twilight sedation would definitely be part of it. And yes, you might have to spend some money and some time to get that certification so you don't have to pay nurse anesthetist or anesthetist, okay? Finally, profound IV, where they're intubated, kind of the real deal, where everybody in the office is wearing scrubs, and it's
This is
It's
like a
on
high
knocking
risk
people
patients,
out.
right? Right.
It's a lot of times done with special needs patients and so forth. A lot of times in a hospital setting, in other words, it's kind of an extreme, and a lot of people that really like the IV experience of delivering that will bump on into level 6. But keep in mind, all of these are markets. Do you want to own one? Do you want to differentiate yourself? This is available. There's a term you use, Wes, you talk about the tyranny of expediency, where tomorrow I have to pay bills. So let's get some patients in here. I'll learn about sedation
Later, right?
next year, whatever. Well, there's certain things you can get started on this and kind of learn that we're telling the truth, that there is a market for people when they do nitrous, they buy big. They refer to others like they're selling them on the practice, as opposed to, yeah, they're okay. It's a good office. Yeah, they're kind of underselling you. So these are the 6 stages. If you want to claim one, great. If you feel like you need guidance on it, give us a call. And we didn't think this up. We've learned this from being in the field and seeing what doctors have learned and what worked and what didn't work.
Yeah, absolutely. So this is all, when you talk about these things, it's all based on what we see out there, and we see abnormalities in practices, doctors doing weird numbers, having weird results in terms of net profit and seeing a handful of patients. And this is what we find out is practices doing sedation, and as they bump up that chain, they have a different life, one that most of you would envy, really. Few staff, larger cases, patients that are really thankful. It changes your whole dynamics as far as the type of office you become. So
I might mention at this point, Dr. Scott Sayer, one of our most successful clients of all time. I think he has told me how many years it's been since he met a patient that wasn't fully sedated and out cold. I mean, and he loves that world, and the patients love him.
yeah.
It's very lucrative, very successful. He spends a lot on marketing, but it really pays back. He's got his associates are in line to become real, full-on sedation doctors, and it really pays out. Everything, the practice, the associate practice, it all pays. So if you have questions about that, let us know. We'd be glad to help.
Yep. Thanks for listening.